Hey, welcome everybody. And just to remind colleagues that the session is being recorded, and that's really for the benefit of anybody who wasn't able to attend today, but who would really like to hear the content and maybe even take the opportunity to provide some feedback separately. So we're recording it so we can share that with everybody who's expressed an interest, and certainly with governors who might not have been able to attend. So for those of you who I might not have met before, I think I've recognised most faces on screen, but I'm Christian Waring, Trust Chair, and I'm really pleased to be welcoming you to this session, which, as you can see on screen, is all about Northamptonshire Healthcare Foundation Trust's annual plan and discussion about our strategy. And this is the invitation was open really to obviously to governors for whom inputting into our strategy is a duty on governors' list of recognised duties, but also we opened this up to members of the trust, which includes members of staff. We have something in the region of 10,000 people. Now, we haven't got 10,000 people represented here, but it's great to see so many colleagues have joined us, and it is an opportunity for people, members of the public, in essence, to join this conversation. So the context is very much an annual conversation that forms part of our planning process, and it's really about helping us to set our objectives for the year and gaining as much input as we can from as wide a variety of people as we can when we're making our plans for 24 and 25. And obviously the year for the trust, that year for the trust starts in April. So this is the precursor to that. So in terms of content for the session, we're going to have presentations on achievements to date in relation to our strategy, and there's going to be a series of case studies. There's also going to be some information about emerging plans for 24 and 25, particularly our plans to tackle health inequalities and our contribution to the local economy. And it's worth saying that one of the things we've really sort of emphasised and really want to put a focus on is that element of our role within the system. And in that context, we're talking very much about adding social value to Northamptonshire. So there'll be an opportunity through a wonderful piece of kit called Slido, I think is what we're using today, to give you the chance to comment and raise questions about this. So really encourage you to take the opportunity to share your thoughts. And as I've already said, we are recording the session so that we can share it with others. So that's really, by way of introduction, all I wanted to say. We've obviously got some slides up already and we're going to be walking through them. And I'll just check in with Richard Smith. Richard, in case there's anything else you wanted to add. If not, I think we can probably go on to our first presentation.
No, thanks, Krishni. We're good to proceed, I think.
Lovely. So I think, David, it's over to you to set the scene.
Lovely. Thank you, Krishni, and good afternoon, everybody. My name's David Williams. I'm Group Director of Strategy and Partnerships here at NHFT. And I was just going to take a couple of moments to just outline a little bit about our vision, our mission, and how that all links to our strategy. I'm also going to do the best I possibly can at sitting still, and part of that is because I'm working in somebody else's office today. I'm in an NSPCC building and they have some pictures of children directly behind me, and if I move too much my background will suddenly blur and you'll get some children's faces in there. So just to reassure you, it's not somebody photobombing, it's the wall behind me from where I'm working, but I'll try and sit still. So NHFT, we have a vision, and our vision is really important for us because it sets out where we want to be, what we expect, and how we're going to get there. So our vision, straight there in the middle, is to be a leading provider of outstanding and compassionate care. And we've thought through those words really, really carefully about how we really do want to be the best we possibly can be, both for ourselves and the best we possibly can be in the country. And that outstanding care is care that's recognised by the CQC, it's recognised by stakeholders, and most importantly, it's recognised by patients, service users, carers and our staff as being really, really good care. But we've also been really clear that that care needs to be compassionate. Our services are about community services and mental health services, and you must deal them with compassion. So we've got our vision, which is our way of saying, there's the goal we're going for. And our strategy takes us from where we are now to the point where we are the leading provider of outstanding compassionate care. We do that with some general principles and some ways that we've got that we call 54321 as a useful way of remembering it. So we have 5 pride values, and our pride values just talk about how we have these values in everything we do. And pride stands for things, and it's people first, respect and compassion, improving lives, dedication and equality. And for everybody in NHFT, we expect everybody to work as a leader. We deliver services in people's homes across all over Northamptonshire. We deliver some services outside of the county as well. And we've got over 100 different sites that services are delivered in. So we ask everybody in LPT to be a leader and to be authentic in everything they're doing, to work together, to take responsibility and to embrace change. And the 3 ways we deliver that are through our directorates. So we have community healthcare, mental health, learning disability and specialty services, and we have corporate services that enable the functions of NHFT to keep working and working things through. 2 enablers, our trust strategy, which is our long-term plan and our way of working, and then our operational plan, which we'll come to later on today, which we build for a 12-month period. So the last bit I wanted to come to you is that mission that takes us to get us to deliver our vision. And our mission is making a difference for you and with you. And it's the for you to provide services to people, patients, our people who live in our county, but also with you because care is a partnership, particularly about community and mental health services. It's things that we'll all do together because we're coming on a journey, both the health professional and also the patient, the service user and their carers, families and so on. So I hope that provides a summary of where we're going. So we're looking at our vision to be a leading provider of outstanding compassionate care. We have our mission of making a difference for you and with you. And our strategy we call DIGBQ, which is develop in partnership, innovate, grow, build and have quality at the foundation that we do. The next 5 slides will just provide you with individual case studies of different examples of developing in partnership, another one of innovating, another of grow, another of build, and another of quality at the heart of everything we do. So I'm going to hand over to Tracy Dempster now, who I think will take us through the develop in partnership example.
Thanks, David. Good afternoon, everyone. I'm pleased to be here to present to you today. My name is Tracy Dempster. I'm Assistant Director for Adult Community Healthcare, which covers a range of adult services that are provided across the county. So the examples that we've chosen to present today are around community nursing and community beds. So a sizable but still small slice of the range of services that we provide within adult services. So in community nursing, we've been focusing this year on our new ways of working and a cultural change model to improve both the working conditions and career options for our staff that are working in our community nursing staff, and also streamline the activities of community nursing so that we're delivering the right care, the right place with the right person at the right time. This work has started in October. It forms part of a 2-year programme, which we have engaged all of our staff in developing, and will engage them in the feedback mechanisms through the next 2 years, with the ultimate aim that we have really close working relationships across our services for adults, primarily around frailty within the community nursing caseload, that we have good relationships with partners in acute services and in GPs, and that we continue to deliver timely care that prevents people escalating into acute settings and helps them to live at home or in their care setting of their choice for longer and in better health. In community beds, we have had a significant challenge around budgets, which was a legacy of COVID, really, where we were rather operating on what the setting needed at the time. So this year we've been focusing on resetting the budget, understanding exactly what staffing we need for the beds that we have in place, and realigning those beds around the demand that we need to meet in terms of stroke and frailty rehabilitation. We've also got our RIBU model in South Northants, which is the recovering independence bed. So that's at a lower acuity, and the ultimate aim is to improve the quality of care within the budget that we are set to deliver that. So the outcomes from this so far have been significantly reduced agency spend, which is good for everyone. We're spending less money, but we've also got more substantive staffing, and that means better quality because those staff provide continuity of care. Development of a surge plan, which effectively means we can step up and step down beds as the system needs it. We have needed it in the last couple of weeks. A substantive flow team, and those people are engaged in making sure that people can move into their permanent care arrangements as soon as a health input is no longer needed at that level of acuity, and also that patients who don't need to be in an acute setting can be moved rapidly into the preferred care setting to continue their rehabilitation. And that involves working closely with our acute colleagues to identify those patients rapidly, to make sure that they're ready for discharge, and work with our ambulance colleagues to ensure that they are transported promptly to the care setting. And this is all delivered at times of real pressure. I mean, you've probably been aware of the pressure that we've been under as a system over the last couple of weeks. So the model gets tested on a regular basis. And it's part of our delivery as part of our partnership across the system. Thank you.
Lovely, thank you, Tracy. I think the next slide's coming over to me for Innovate, and I'll just talk through a moment there. So we wanted to just share with something as part of the innovation work that we've done, because Tracy with, sorry, I think I just lost there. So the developing partnership work that we've done with local authorities, ambulance trust and our acute hospitals. I'm just going to come through an innovation example and talk you through about our CAMS work. Now, CAMS is the Child Adolescent Mental Health Services, and we've taken on a responsibility to support the inpatient, so the in-hospital CAMS services, and help create some focus across the whole of the East Midlands, including Northamptonshire. And what we recognised that we'd do together with NHS organisations and charities and others is we could improve access. We could make services better by having a single point of contact, so that if there are children or young people needing admission into hospital for their mental health, how do we make sure we all understand their needs and we can find them a bed in the right place as fast as possible? What we'd also recognise is that sometimes people come into inpatients, they come into hospital because we've run out of community alternatives. It's not that they necessarily need an inpatient stay. So the next thing we did was to invest in what we call CAMS 3.5. And the reason we do that is there are 4 tiers of CAMS support. Tier 4 is the inpatient support. And what we were recognising, and Tier 3 is one of the community levels, what we were recognising is we needed an additional level of support in there. So we created CAMS Tier 3.5, which is really about intensive support for people in the community. That's delivered a 20% reduction in beds for children and young people across the East Midlands. That's resulted in the waiting list dropping. So from 30 young people in 2021 on average waiting for a bed, down to about between 3 and 5 at any one time. That means we can get better support to people and their families quicker, more timely. And because we're using our money better, we've been able to really look at the care packages we've been doing, and we've been able to create a surplus, which we've then reinvested back into community CAMS services. So it's a good example of how do we come together, solve a problem, find a new way of working, which delivers better outcomes for other people. So I hope that's a quick example of innovation. I think I'm handing over to Becky now to take you through an example of growth.
Thanks, David. I'm Becky Salisbury, Deputy Director of OD and HR Transformation. What we've got on screen here is the 4 pillars of the NHS People Plan. It is a national people plan, and within NHFT we've set out our own local annual plan that fulfils our kind of the people agenda under each of those 4 pillars. I won't go through each of those because there's an awful lot of activity that underpins that plan and have been our kind of area of focus for the last year. But I'd just like to spend the next few minutes just highlighting a few of our achievements against each of those pillars. So under looking after our people, we've had a really comprehensive wellbeing support offer for our staff, including financial wellbeing, with the introduction of a Citizens Advice Bureau caseworker to support our staff. We've had the delivery of the Staff Virtual Wellbeing Festival in 2023, which has been an annual festival available for all staff across the Northamptonshire system, with increased engagement across the board. During 2023, we were also shortlisted for 2 national awards, the Healthcare People Management Awards and the Health Service Journal Awards for staff wellbeing as well. Under Belonging in the NHS, we've run a series of conferences for our staff, focusing on compassion primarily, continuing our compassion commitment and journey of compassion. We've received the Stonewall Accreditation Gold Award for our work on EDI, and we've seen improving metrics across our workforce race equality and workforce disability equality standard as well. Under the Growing for the Future pillar, we've built on our successes for international recruitment, both within nursing and the introduction of a number of international medical graduates into our workforce. I've also created a workforce planning process and structure as well, looking at alternative pathways into the workforce through things like volunteer to career pathway and growing our apprenticeships. Under the new ways of working and delivering care pillar, we are in the process of developing a corporate welcome, and we've really reshaped our training and leadership development offer for our leaders, building on and introducing a new excellence in leadership programme across the organisation, providing a much more focused approach to our leadership development. The outcome metrics for this plan are currently in the process of being finalised. We use our workforce dashboard and also metrics from the staff survey, which is due to be published in the next month or so, which will help demonstrate the impact as we look into 2024 to reset our priorities for the forthcoming year.
So, hello, afternoon, everyone. My name is Paul Sheldon. I'm the Chief Finance Officer, and by way of the build element within our strategy, just wanted to give you an example which dovetails with what both Becky and David have just been referring to from an estates perspective. So, some national guidance a few years ago now related to what was called new care models required that all of those CAMHS inpatient wards that David referred to were located on a main hospital site. We were able to secure national funding to move 10 beds from the set, which is currently not far from Berrywood, but not actually on site and is a standalone unit. We were able to secure that funding to move the whole of that unit up to the main mental health hospital site at Berrywood. Again, this is about improving outcomes for patients, and once we complete this, which will be end of March, early April, we'll be able to start delivering those quality improvements for patients. We'll also be able to care for more patients with higher acuity, which we are seeing over the last 2 or 3 years, without disturbing the fact that young people can remain close to home and everything that they know in the local vicinities. And it also dovetails with the innovation that David referred to around community CAMHS services and means that young people can move without friction between those tiered levels of services that they may need. And as Becky was just talking about, this is another part of how we can improve our recruitment and retention as well. And so overall, this is something that enables us to improve things for patients, but also for staff. And I think I'm handing over to Alison.
Thank you very much, Paul. So I'm Alison Barsley, I'm the Assistant Director for Professional Education and Training, and I'm standing in for Linda to talk about the quality improvement. So in terms of quality improvement, we've done a lot of collaboration with LPT to enable improvement in quality and safety across both trusts. And that's been about a consistent quality improvement approach in terms of training, life QA, I'll explain in a second, and programme support. So we've implemented the QSA programme, the Quality Service Improvement Redesign Programme. We have redesigned the quality framework, which actually went to board in November last year and has gone to the Quality Summit today for further discussion. We've revamped and implemented the patient safety in response framework, PSIRF, and had lots of engagement with staff. So we're implementing a group training pathway for associates, and there's a plan to get a number of percentage of staff across trained in terms of QSA and quality improvement across the group. The Life QI database is a database of tools and data that allows people to access quality improvement methodology, and so it's a model built for improvement. So it gives easy access for all staff to be able to get involved in quality improvement projects over the next few years. And we've got measurable improvements in quality improvement programmes in the main priorities around pressure ulcer care, recognition and care of deteriorating patients, and the safe mental health observations. Also added into that is actually reduction in violence and aggression towards staff, and a better oversight in terms of a dashboard and heat maps to give us an early warning system for where things might be going wrong, so that we can actually put improvement plans in place into risk areas that have been identified through the dashboard. Not sure who I'm handing over to. Sorry, that might have been a bit quick.
Thanks, Alison. I'm just aware David popped in the chat just about acronyms. If there's anything you want to follow up on, David, put it in and Alison can confirm it. So I'm just going to talk through the NHS England and the NHFT annual plan. So the context for this is that every year NHS England publish a set of guidance which traditionally has arrived in December for the following financial year's ambitions. We don't actually have the guidance yet at this point. We're expecting it soon, but there are various perspectives on whether it'll be this month or into March, and partially that's down to some of the challenges with strikes and what the actual settlement will be for the NHS more generally from the departmental bodies, Treasury and Health and Social Care, but also some sticky issues such as neurodiversity and ADHD, where we've got massive unexpected demand in those services post-COVID, which we need to get a kind of a confirmed trajectory from central bodies on the way forward. So I'm just going to talk through what's in that ambition for the NHS England plan. Expected to see a continuation of recovery of services. For us in NHFT, that relates to our mental health services clearly, but also the support we offer to acute pathways such as elective and cancer recovery pathways. So we've got a real strong role to play in acing some of that, which we're doing, as the team have outlined, with developments in RIBU, recovery independence beds, with local authority partners, etc. A drive on improving productivity. So the general sense is that there are more staff now than there were during COVID, but productivity is less than the 2019-20 baseline. There's quite a lot of definitional detail that probably isn't captured in that, and the debate continues about the productivity frame. But needless to say, we can always continue to strive to do more with what we've got. That's part of our public sector duty as a public sector body, and we would be enshrining that in our ambitions in our annual plan for 24-25. Continue to make progress in the long-term ambitions. Mental health was front and centre in some of that, but equally elective cancer, diagnostics, etc., remain a key focus. And then transforming the NHS as set out in the 24-25 priorities and the yet to be received planning guidance, which will no doubt capture some of what we're trying to achieve through integrated care boards and integrated care systems. So for us, we would be looking, we only have one strategy, which is DIGBQ, and this plan will fall out of our DIGBQ strategy. So the work we do today is quite important to set the tone for that. So we'll be progressing that through the 24-25 plan, but also looking ahead into the medium-term plan, which we will be contributing to as part of the ICB. The ICB too, as I say, has its 5-year forward view, focusing on a number of things that we would recognise. There's a set of new diagnostic hubs being established in the county. There's obviously potential rebuild with Kettering now confirmed as one of the new hospitals. Things that have been confirmed certainly imminently, that would be one of the hospital sites. And then we will be responding to those priorities, and hopefully, as I say, things like ADHD and so on will be reflected in some of those documents that come out from NHS England in due course. So just next slide quickly. Thank you. The context is obviously challenging financially for all partners, and we've got to make sure that our productivity is in line with what we would expect. So benchmarking will become a key part of what we do, and making sure we're counting outcomes and outputs. That's really important to us as a trust, because when we get into the outcomes bit, we can really begin to understand our populations and how they respond to what we're doing. So that's a real critical part of our opportunities for next year. Workforce remains a real challenge, both in the East Midlands, West and nationally, and we're doing as much as we can to eliminate vacancies that we've got and make sure they're filled with staff that stay with us for a period of time, using some of the things that Becky talked about in terms of our overall well-being staff offer, which I think is critical to how we operate as a trust. Health inequalities be a big focus for us next year. We've Alison is supporting getting a population health board established. We'll be looking at inequalities across everything and checking where we've got variation in outcomes, and then stripping that back to understand why, and then really looking at how we reframe services to manage those needs differently. I think Northamptonshire is probably if it's not the highest, it's the second highest in terms of census population growth in the Midlands, if not nationally. So we're seeing striking numbers of projections of older adults who will be frail and will require support for services. So the life expectancy here is quite good, in fact, in the 80s, but quite a lot of those people living longer have poor quality in terms of life outcomes. So we've got work to do, and we've got to do that in an integrated way with our local authority partners and indeed our CUBE partners. CYP services continue to be under pressure. They will be a major focus of our work with partners again going forward. It's fair to say nationally it doesn't feel like CYP services are properly reset after COVID, and we're seeing quite a longitudinal impact from COVID across children's services, which we need to keep going. And thanks, Alison. CYP is children and young people. Tracy talked about our adult community offering in terms of integration, and then there's kind of a risk, obviously, as commissioners look to do things differently, and we've now got 2 unitary authorities. That would probably add a layer of complexity to how we organise services and indeed how we're funded for them as they get their head around it. I've talked through some of the opportunities that they spin out of the risks and challenges. The key thing I guess I wanted to emphasise here is the inequalities and social value opportunity from the work we do. And I think there's an enormous opportunity for us as a trust, because we are place-based and have multiple campuses across the county, the 2 unitary footprints. We have such a real rich opportunity to think about those communities and making a real imprint on them as NHFT, and that's going to be a big part of our plan looking into 24-25. So can we, Richard, I think you're going to take over on the facilitating this bit, and then obviously any questions on the planning bit I can pick up as part of that.
Indeed. Thank you very much, Dave. Good afternoon, everybody. My name's Richard. I work in the governance team along with some colleagues that are behind the scenes moving the slides and other such things. Hopefully you've enjoyed the content so far. We're now getting to the stage where we're going to be inviting you to share your thoughts, feedback and questions. So we've got a site called Slido through which you can post your questions and comments online. My colleague Tracy's put the details up there on the screen. For those of you using a smartphone, I believe you can use the QR code on the right hand side, which will take you straight through to the relevant page on Slido. I was a little bit trigger happy earlier with my message, but I've also re-enabled that so you can click on the link in the chat if you prefer. And what we're interested in, you've heard from colleagues about the work we've been doing over the last year on our existing strategy, some of the successes that we've already had. And you've heard from Dave just there on some of the challenges that we need to address over the coming year, some of which are national challenges, some of which are more specific to Northamptonshire. And some of the opportunities also that we're looking to exploit. We're really keen as we start to formulate our own plans, which the board will consider and hopefully approve at the end of March. Really keen to get your views as governors, as members of the public on what's important. So I'd invite you to comment using Slido on what is most important from your perspective for us to consider in our plans for the coming year, so from April 2024 for the next 12 months. Do please put your comments in there, and hopefully if the technology is working, we should start to see some content on the screen.
It is now open. There was a bit of a lag, but it is now open on Slido.
Oh, brilliant. Thank you, Tracy. I can see we've got a few people typing, so that is good news.
Now it should appear on the screen once people start. This is where we hope the technology works now.
Addressing waiting times. Yeah, I dare say that will be something that crops up quite a bit. Outcomes for people. Improve our CAMS response times. So this is our child and adolescent mental health services. Focusing on quality of services and care for patients. Partnerships. You can see the text moving around on the screen, but prevention. There we go. And backlog maintenance. So that's maintaining our physical environment, our estate, as Paul was describing in his section earlier. So some more partnership working. Addressing inequalities, yes. So this is something that is also one of the national priorities, as I think Dave was describing. Making sure our allied care professional roles are utilised, ACPs. Yes, certainly something that we will need to come to terms with is the results of both the local and the national elections, which we're led to believe at least will happen at some stage this year, date to be determined. So it looks as though there's nobody else, or there is somebody else typing. Transformation of services, yes, indeed. And staff wellbeing, I think, is one I haven't read out there. So actually, that's really helpful, actually, and starts to give us a flavour of some of the things that we should be looking at. So just in case there's anybody that's still thinking or typing And thanks, Alison, for correcting me. ACPs, in fact, advanced clinical practitioners. That's really helpful. Thank you. And incidentally, on the slides, to David's point earlier on, we will just make sure before we circulate them to spell out any acronyms we've used in the slides. As I can appreciate that would be a barrier for people engaging with the content. So thank you very much for those contributions. As I've alluded to, what we are going to do is harvest the ideas that we've got from you today, collate those with other engagement work that we're undertaking between now and the end of March, and use that to inform then the discussion and ultimately the decision the board makes at the end of March on our plans for next year. So I think we're now going to move on to a section where we explore inequalities in a little bit more detail. So if I could invite Tracy to move us on into the next section. Thank you.
Has it moved on the screen, Richard? Because I've clicked.
It has, yeah, we've got the title slide here. Thank you. I think it's over to you, Glenn.
It's nice to meet everyone. I'm Glenn Edwards. I'm Head of Strategy and Partnerships for NHFT. And I'm really proud to be leading on a piece of work which looks to identify and tackle health inequalities for the Trust. I think we can go on to the next slide, I think, Tracy. Thank you. I'm sure you're all aware that health inequalities can affect different groups in society, and we have listed a few of the communities that can often have greater levels of health inequality on the slide just now. There are known factors that can often heighten someone's level of health inequality, and this can include someone's employment status, perhaps if they're living in poverty, and this is being exacerbated with the current cost of living currently. Their housing, if they're at risk of or considered as homeless, lack of social support, and also low levels of health literacy. In short, those that may have health inequalities generally have poorer health earlier and often for longer. So the work to tackle health inequalities across NHFT is really important to us as a Trust. People experiencing health inequalities can often reach out to our services, but often at a point of crisis, so finding it difficult to prevent ill health. They can also navigate lots of additional services from different agencies at the same time, which can have an impact on accessing our service, so perhaps conflicting appointment times, and generally their experience of the support they receive too. But as a Trust, we're passionate about providing the best experience of care, and we've launched a new programme to specifically look at tackling health inequalities across the Trust, which is really exciting. We have pockets of great practice across NHFT in addressing health inequalities currently. We have a bank of significant learning from the pandemic in meeting community needs differently. And we also have access to data which highlights health inequalities, perhaps before people access our service, during their care with us, but also when a patient leaves after receiving care from us. The programme will look to create opportunities to increase health literacy within our community, but also, perhaps more importantly, support our staff with access to disaggregated data that can highlight health inequalities within our current services. And we seek to provide them with accessible information that they can stratify and co-design solutions with the communities and our patients. The programme will focus on DNAs and patients who cancel appointments initially, but ultimately we want to better understand why people DNA, understand the barriers to attending, and understanding what we can do as a Trust to better meet their needs and ultimately reduce DNAs, increasing attendance and health outcomes. Yeah, DNA, sorry, do not attend. But we would do this with the communities and the service teams in a co-design fashion. The Trust has a requirement to publish specific health inequality data within annual accounts over the coming years, and this programme will provide a measurable assessment of our success in tackling DNAs and cancelled appointments by the specific cohort, so it's really important. Leading on this work has enabled me to be part of the National NHS England Health Inequality Ambassador Programme, where senior health inequality leaders come together across the UK to share ideas and profile such transformational programme. And this programme has gained a significant amount of interest at the moment across the country, as it's something that many trusts are challenged with. Richard, I think I'm handing back over to you.
Thanks very much, Glenn. So we've heard, I think, a pretty compelling case as to why we need to be thinking about health inequalities and some of the impacts if we don't get it right. So even if you didn't think it was important beforehand, I'm sure you will agree it is something we should be focusing on now. So within this particular area of health inequalities, are there any particular areas or things that you feel that we really need to be focused on, again, over the coming 12 months? So I invite you back into the Slido portal to share your thoughts and views with us. And we'll just take a moment to see what people have to say coming up on screen. So yes, I think we'd all agree that it's very important to support everyone, and I think that was that came across in some of the evidence that Glenn was quoting from, actually, that there's a wide variety of different needs actually across our communities, and the first step is really understanding those differences and how best then to support people in their different circumstances. Equitable access to information. Yes, I think this is important. We've learned quite a bit from our work with our partners in Leicestershire Partnership Trust, who have done quite a bit of work in this area with different communities. Anti-racism, so we're committed to a programme of work again with our partners in Leicestershire, being together against racism. We've made some good progress so far, but it's certainly clear that we've got more work to do. And it's an exciting series of workshops that are happening on this topic at the moment. Working in partnership, again, we're aware that actually what you see depends on your perspective, and actually partnering up with different agencies, different people across our communities gives us access to parts of our communities that are otherwise hidden to us as an organisation, often with people with needs for our services. Promoting understanding of pathways. So again, very often it's difficult to navigate your way through the NHS, and actually that provides a barrier for some people in engaging with services that they need. So that's a really important point. Understanding the drivers for health inequality. So what's actually causing the inequity? Can we actually tackle that and remove some of those barriers? Helping people to take charge of their own health. So we've done quite a bit of work on this in the past, certainly with people with long-term mental health or physical health conditions. There's certainly more of that work that we've got planned. It's difficult with things moving around the screen here, but I'm trying to pick up everything that's being said. So focusing on underserved communities. So as we start to identify, as Glenn was saying, those pockets of people with poorer health outcomes or different needs, and actually working together to understand how we can best support them to access services that they need. Staff shortages, yes, that is certainly something that we've been focused on, and Becky alluded to some of this work as part of the grow theme to our strategy, how we're making sure that we've got the right cadre of staff working in the different services across the organisation. Language barriers, so yes, I think that also resonates with the point about making people aware of the services that we've got and providing good access. We've certainly got translation services and other such facilities that people can access our materials in different languages. And indeed, as we start to engage more with technology, this is becoming easier and easier. Okay, I think, joined up services and partnerships. Yes, of course. I think certainly something we hear consistently, sadly, is the difficulties that people are experiencing having to tell their story multiple times to different agencies. And that's certainly something that people regard as frustrating, and something we're working on, again, supported by some of our digital technology, so we can share information between services appropriately. Right, thank you very much. I think we've exhausted the contributions at this stage, but we shall come back to some contributions a little bit later on. We're now moving to another part of our plans, which relates to social values. This is our contribution to our local economy. And I think I'm handing to Alison for this section. Alison, over to you.
Right, thanks, Richard, and welcome everybody. It's really lovely to be here today. And I'm Alison Gilmar. I'm the Director of Strategy and Partnerships for NHFT, and I'm here just to sort of chat through social value for a few minutes, and to sort of open it up to questions as well, to hear your thoughts and ideas in terms of what we need to do in this space. Next slide, please, Tracy. Thank you. Okay, so I think Krishni gave us a really good insight in terms of what social value is, but I'm just going to give my thoughts in terms of what I think it is. So for me, it's something about that added extra, that hidden activity that we do that we don't recognise, we don't even really measure it, we just do it, in that we give back to our community quite unintentionally, just by the sheer fact that we exist as an organisation. So, for example, pulling up things like how we add economic value to the community just by employing people locally and then them going out and spending their pound. How we add benefit to our environment. So currently work underway looking at what our carbon footprint is and how we can actively reduce that. And other social factors that we add to, so improving quality of life, improving people's health and well-being, and some of that important work that Glyn's just talked about in terms of reducing inequalities. So what are we doing about this and what have we done so far? During the last year, we've been working with our staff and partners internally to look at what's important to them, and we've created and published our social value charter. And this was published in November last year. I think it's important to say that that social value charter is also aligned to the ambition of our local ICBs, and it sits across Northamptonshire and Leicestershire. So part of adding social value to our community is how we work as an anchor organisation in our communities. And then to do this, we've really worked hard to identify those areas that are important to us. So there's priority areas. I'm going to focus on those for a few minutes and talk about how through our commitments against these priority areas, we'll deliver our commitment as an anchor organisation and to deliver social value, and also thinking about how we can measure it and how, most importantly, how we are actually making a difference every year going forward. So what are our priority areas? So you can see them listed here quite clearly. I'll just talk through these briefly. So organisational resilience. So this is about thinking about how we can be a good employer, how we can create real benefit and real meaningful career opportunities for the people living locally. Committing to, for example, flexible working, paying people for the work that they do, and making sure that is in line with any national policy guidance. Also providing in-work training, so understanding the different needs of our workforce, really committed to making sure that they have got the skills that they need to do their job. Looking at how we drive economic inequality, so for example, striving to increase employment for local people, especially from those areas where we've got high deprivation and unemployment, looking at creative ways that we can get these people back into the workplace, so their well-being, their outcomes, their economic position in society improves. Creating employment and training opportunities for local people, including opportunities that contribute to that increased and improved social mobility that I've just talked about, and really is supporting the local economy to create jobs and apprenticeships. And also through procurement, thinking about how we buy our goods. I know Dave Mayer always talks about, where do we buy our chairs from? We've got so many chairs across the organisation. How can we think about our purchasing power? Could we buy them all locally to add even more economic value? Climate change. So thinking about our green plan, recognising our responsibility to protect and improve our environment, reducing waste. I know we've introduced some new ways of working, for want of a better word, in terms of the cutlery and the plates and things that we're eating off in our Cafe V, for example, that move into a disposable, not a non-disposable, but a reusable plastic system, which is great, and disposable cutlery. Monitoring and reducing our carbon emissions. Equality of opportunity, so really valuing the contribution that everyone makes to the work they do, making sure that our staff feel listened to, that they're valued and that they feel safe at work. How we improve patients' outcomes and how we make sure that everyone feels really empowered to achieve their own personal goals. And then finally, volunteering, recognising the value that this brings to everybody, that it builds new skills and opportunities and provides a fresh perspective on life and providing routes into employment, for example. So these are all things that we focused on that are our priority areas, and a lot of them are actually hidden. They're undeliberate, they're unintended consequences of us being here. What we want to do now is just open up the conversation. I think Richard's going to take us through in terms of thinking about hearing from you what's important to you and what you think we could do that is actually adding extra value on top of all of that hidden activity that we've just reflected on and talked about. So I'm going to hand over back to Richard, I think, to take us through the Slido.
Thanks very much, Alison. So yes, as a healthcare provider organisation, we really understand the real impact that what are often described as the broader determinants of health have on people's health outcomes. Around 85%, I think, is the figure of things that make a difference to somebody's health outcomes, and not, in fact, healthcare services, but where you live, the employment that's available to you, and your economic circumstances. So it makes real sense for us as an organisation to really invest in our local communities and improving people's health and well-being, making a difference for and with people, which is, of course, our mission. And in addition to that, something that's become, thankfully, much more topical across society is then that broader environmental imperative of actually making sure that we're sustainable as an organisation. So a really clear motivating reason for us to be focused on social value. So Alison's talked through some of the areas that we've focused on in constructing our charter, and hopefully this has stimulated your thinking on some areas that we might be able to focus on. I'm aware that we've got people from partner organisations and patients and staff members. So it'd be great to hear from you if there's anything that you feel that we ought to be focused on as we construct our specific objectives regarding social value for next year. And again, please do use the Slido function to pose your comments or thoughts, and we'll see what people come up with. So measure and report on it. Yeah, I think a really important point, actually. Some of these things are difficult to track, and we can put a lot of effort into things, and we do really need to check that they are in fact making a positive difference. Prevention and public health, again, that's something that we're really passionate about, and in fact we've got a session coming up with our colleagues at KGH, actually, for governors to get to grips with some of our public health information, to think this through in a bit more detail. So staff retention, of course, we're a big local employer. We've got around 5,000 staff, I think it is, and together with our colleagues at the 2 acute hospital trusts and also the councils, actually we're a big local employer, so we can make a real difference. So focusing on providing careers, not just jobs, is definitely what we're here to do at NHFT. So I think that's a really important point. Allied to prevention, then early intervention. So we had a workshop actually earlier today where we're looking at people living with frailty and how we can support people to live well for longer, rather than necessarily becoming unwell and intervening just at that point where they're presenting for a hospital admission. Working with local business, again, this is something that we've done in conjunction with public health in the past, and I think Christian, in fact, used to chair one of the groups that interfaced with some of these wider local organisations in the past. So allied to prevention, so less reactive responses, so more proactive work, and again, alluding to some of the work that we've been doing with data, we've been able to start to predict things much more effectively now, so that we can intervene sooner and in a more joined up fashion with our colleagues. So allied to the point that was raised, I think, in one of our previous discussions about partnerships, a suggestion there that we need to be linking in with schools and colleges. And I know we've had some success with a project that was run by one of our governors, actually, in the past year, building links with one of the local schools in Northampton. So there's a lot of support for staff retention, which is good to hear, because that's a firm part of our grow objectives. Just checking whether I've missed anything. Link with faith groups, actually, yes. And again, that's something that we've looked at before. I know we've had some of our governors that are linked in with certain faith groups, and actually, again, they're able to reach parts of our community that we're often not able to reach as a NHS organisation. Okay. Building community identity. So yes, do people understand who we are and what we do? And that probably links back to the previous discussion we were having about, do people understand what services are available and how to access them? Great. Well, thank you very much indeed, everybody, for using Slido and giving us your thoughts and feedback. As I said, this will be taken into account as the board starts to prepare its plans for the end of March. I think we have a little bit of time still remaining. So before we talk about where we head next, I just wondered whether anybody did have any questions that they wanted to pose to any of our presenters. I know a couple of our presenters had to go to another meeting, but I didn't want to forget to give you the opportunity to ask a question. So do please pop a question in the chat if you have one, or indeed if you prefer, you can ask a question via email, and we'll come back to you after the session. Okay, I'm not seeing any comments in the chat, but just in case people are typing, I'll just talk through this slide here around the next steps. So as I've mentioned, we will be collating feedback from today's session together with other engagement work we'll undertake as we move towards the end of March. On a really practical note, we will be sharing the slides and the recording once it's available with everybody attended today, but also those that registered that weren't able to join us. And we will also accept feedback and comments via email afterwards. As Dave was talking about, we haven't yet received the national guidance to formulate our annual plan. So, of course, once that has been released, we will then need to consider that and respond to it. We will be working, of course, with our partners in the local health and care economy. That includes colleagues at Kettering General, Northampton General, the Integrated Care Board and the councils, to come up not just with a plan for NHFT, but a plan for the whole local health economy, which will be submitted to the national team, and then will, of course, be available for everybody to view. So we're certainly expecting to have had all of that work concluded by the end of May. And then throughout the coming financial year, I would point out that all of our meetings of our board in public are available online. So you can join live via Microsoft Teams and see our website for details on how to do that. Or if you're not able to attend live or just want to understand a particular section of the board's discussion, we do record these sessions, which are then made available on the website. And at these sessions throughout the year, we'll then be reporting on the progress that we're making with our plans. So do please look out for that over the coming months. So I don't see any questions in the chat. So what I will then do is just thank you very much indeed for your contributions this afternoon, and hand back to Krishni for some closing remarks. Thanks, Krishni.
Thank you, Richard, and just really want to thank everyone for participating in those contributions to sliders. Really always find it really fascinating to see people's input sort of developing on screen whilst we're looking at it. So thank you for those contributions. I think there are probably a couple of comments in the chat, Richard and David, which I'm sure you'll pick up as we go, but do encourage people to add anything further that you'd like to, and of course, as Richard said, to email us as well with any further thoughts. But I really want to thank all the contributions from presenters. Always know that it takes a lot of effort to put these things together, so particularly value that. I think there were some really good stories there about things that Trust has achieved, but also really helpful insights from people about where they would like us to focus going forward, which is great. And we, as Richard said, I think we'll be sending out the slides and the actual recording of the session, so there'll be availability of that. And I really would like to take this opportunity also to remind everybody on the call that actually, whatever your role happens to be, unless you're a board director or something like that already, you can be a governor of the trust, and there are elections coming up. So please remember to encourage people that you know around Northamptonshire, and indeed, I think the rest of England constituency, although I can't remember if that's up for election, so I might be encouraging that one incorrectly. Tracy, what do you think?
It is, Krishni. So
it is.
Just while we've got a bit of time, I'll just announce we've got all 5 staff governor seats are due up. So all staff are now members, so can stand and vote in elections. We've got 2 public Northampton, 2 Daventry South Northants, 1 rest of England, and I think it's 7 patient and carer seats. So we've got lots of seats due up this time. So I would encourage everybody, if they don't want to stand themselves, to think about people they may know that might be interested in becoming a governor. So, and it's open to the end of this month.
Thank you, Tracy, for adding that information. So really would encourage people who are watching this now or watching it later to consider standing for election, re-standing for election, because obviously existing governors as well, we would like to encourage. And if not being a governor, certainly maintaining your membership and coming along to webinars and other opportunities. I think we're going to try and continue our programme of webinars and perhaps engagement opportunities for member and governor events. And Tracy, do you happen to have what our next webinar is, just in case we can plug that as well? Whilst
I do. I was just desperately trying to find the link. We've actually got one next Wednesday, which is one that's actually starts at 5 p.m. and this is on the Children and Young People's Participation Team, a bit about what the Youth Advisory Board does and a bit about iDiscover, which I believe is a bit like the Recovery College, but it's specifically for young people. So if anyone's got any interest in that or knows any young people that might be interested, I'm just going to get the link to the booking form, if you bear with me for just 2 seconds. And that's next Wednesday, the 7th of February at 5 o'clock. So I'll just put the link to the booking form for that webinar next Wednesday.
Lovely. So there you are. The link has appeared. And in fact, you'll be able to find it on our website as well if you haven't, or indeed drop a note into us. Now, I can see someone's put their hand up, actually. Is that Laura? I don't know whether we can bring Laura in.
Sorry, that was a mistake.
Ah, okay. Don't worry, Laura. I thought you probably, I just wasn't sure because sometimes you can, people can press raising hands when they mean to put a thumbs up or something. So we've all done that before, but no, that's fine. So yes, encourage people to attend that event. Please, as I say, encourage colleagues and networks to participate in that and also to stand for election, as we've said, or indeed vote in the elections, because that's the other way that you can participate and use your membership effectively. So thanks again, everybody. Really appreciate the contributions. Thanks for all the efforts with slides, etc. And also another plug for our annual meeting, which will happen later in the year. So watch out for that, because that'll be another opportunity for people to ask lots of questions of us and engage with us about what we've been doing and our plans for the future. So thanks, everybody. I'll close the meeting there and we'll stop the recording. Thank you.
Thanks, Christine. Thanks, everyone.
Thanks, everyone. Bye-bye.
Bye-bye. Bye.